and prescription medicines that can put people's health at risk include things like St. John's wort, even ginkgo biloba, if people are compromised with blood clots, blood issues. So if you're on warfarin, for example, you should avoid taking a herbal as ginkgo biloba. It's good according to research for the mental functioning, normal functioning, and increase that, viability within the brain. But if you on warfarin, for example, you should stop because it increases the chance of bleeding. So you don't want to do that. If you're a menopausal woman who is taking St. John's wort, you don't want to do that because it can interact with your other anti-menopausal drugs that you're taking. So these are some of the complementary medicines that can have side effects based on what you're taking, if you're taking it with prescription drugs, or sometimes even if you're taking it by yourself. So that is why it's critical.
I don't think anybody's saying anything wrong with complementary medicine.
No. We're looking at it here. No, we're looking at it here, and I forgot to mention that at the start that I am not in opposition of complementary medicine. What I am saying, if you are compromised managing your therapy at home, this is what we're looking at. We're not just talking about drugs. We're not just talking just all over the place. We're focusing on how to manage your medication at home. So we're saying if you're chronically ill, if you have diabetes, hypertension, high cholesterol, if you're an asthmatic patient, if you're on medication chronically, even not if you're on prescription medication for 7 days, for 21 days, for 3 days, and you're accustomed of taking your natural remedy, you take your vitamins and your supplements every day. What we're saying is important that you would ask your pharmacist a question. If you come just to the pharmacy over the counter for something for the flu, if you're diabetic, if you're hypertensive, you're not going to see the doctor. You just want something just to relieve the symptoms. You need to tell your pharmacist, I am a diabetic, I am hypertensive, I have high blood cholesterol, you understand? I'm on warfarin. So at that point, the pharmacist can make the best decision for you. So you don't just go and pull stuff off the shelf. Another very interesting thing is that, and people need to be very mindful, is going to the supermarkets and pulling stuff off the shelf for these same people that are compromised. So I'm not talking about taking your supplements every day. Of course, I take my supplements too. But if you have some type of condition, you need to discuss that with your pharmacist if you're not going to your doctor. However, if you're going to your doctor, you also need to talk to your doctor about that.
Okay, well, on this note, we'll take a break. We'll take a short break. A word from our sponsors. We'll be right back, and we'll talk about what is the chance of a side effect occurring. We will talk about that in a while. Léana sorti docteur côté Hasbury ma oui number 1 ma li pièce biologie en lettre maman il dit c'est eulogy il dit number 2 pas mettre moi sous ice mon canyon fouidi ma oui dit gardez surtout quoi parler non speak life man les mener ali dans côté quick care pharmacy là you want to là c'est what this year yani ouvert pour 72 hours of sleep because everything about quick care pharmacy speaks of life plus nani bell clean spacious plans different list have your medicament par quoi the air condition c'est what this your oasis in a desert land you just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Care Pharmacy and Halsbro, set up your blood pressure and sugar check one time and get your top up too. And I you put 20 on my cell phone. And of course, over the counter drugs and prescription drugs. Après envie an ID moins depuis jouer aller côté Quick Care Pharmacy. Her outlook on life has changed. If you battre any buy medicine, mais you parler buy. Actually make aller exercise tous les bons matins, can leave him away. Get up, lazy Harry. Harry him toujours a dit il a si carry on last reserve. The last shall be the first Harry. Move that body Harry. Quick Care Pharmacy are ouvert Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4. Okay, welcome back to Tablets and Spoonfuls as we continue talking about understanding side effects. And we've already looked at what is a side effect. Can prescription medication cause side effects? Can complementary medicine, natural medicine cause side effects? No question. What is the chance of a side effect occurring? Because we already said that sometimes it doesn't affect people. You might see a whole set of things listed on a box of medication, but there's no side effect. What are the chances?
Maybe we might say 50-50 because your doctor can never predict, as I said earlier, for certain whether you will experience a particular side effect or not. But he or she, your doctor, can inform you, even your pharmacist, if you're using something over the counter without going to the doctor, can inform you that what to look for, okay, and how to respond if such effect occurs. Because some medicines, they seldom cause side effects, while others can produce great effects in almost every user, okay? So some side effects are common with particular medicines, while others are rare. They might tell you, okay, the list of at least the 10 different effects that are common to everything. Among some of them are like nausea, constipation, a headache, dizziness,
skin rash.
a skin rash. So some of those that are most common with the drug, it's almost guaranteed that you would get that effect. Even sleepiness, you understand? So they're not serious, as in serious, but for example, like sleepiness, it is not a serious effect, but we have to inform the patient of that possibility of being drowsy, because if you operate in machineries, if you drive in a vehicle, you have to be aware that the drug has a potential to make you drowsy. So you need to know that.
Your employer might think you're just lazy sleeping on the job.
Exactly. And then you might find you're drowsy and trying, why am I drowsy? You may not even realize it's the drug. So while it doesn't seem that serious, but it needs to be brought to your attention. So the chance of a side effect is 50-50. As I said, sometimes even a side effect that's not listed might happen. So it's almost difficult to go beyond what is common within the side effects.
Okay, and what are the possible consequences of a side effect?
Okay, you may have noticed that some medicines come with warning labels about rare or uncommon but serious adverse effects, events, reactions. So in general, these merit concerns because the consequences pose a serious life risk of life-threatening or permanent harm.
It can go that far.
Right, it can go that far. Even the chance of a rare serious adverse effect occurring in someone increases if a larger number of people take that medication over time. Okay, so if you're taking the medication over a long period of time, depending on what the condition is, that is a possibility of experiencing some sort of side effects. However, the benefits provided by the medicine may still be worth the risk. Because some people might be just hearing me saying that and say, but okay, if it's going to cause such a serious effect, why should I take it? But what happens is that you have to take into consideration, talk with your doctor, you have to decide, okay.
Right, that's why he may decide it's for 5 days or 7 days or whatever, or this amount and blah, 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 blah. How many times a day.
Yes, that comes into play, but it is a little bit deeper than that because there's a risk, a life-threatening risk or some permanent harm to you. Okay, you have to decide because of what is happening to me, I'm going to take that or just let the disease or the condition just do what it has to do. So depending on the factors, including the seriousness of the underlying disease, you will tell your doctor, okay, yes, I'll go with it. For example, we have women with menopausal women who their life has just changed like tremendously, physically, emotionally, it's just whack. And so there are type of drugs, postmenopausal drugs, that if you were to use them like hormones, estrogens, they can calm you and bring you back to yourself. You understand? But the effect over a period of time, the consequences over a period of time might scare you into wanting to take it. But you say, you know what? I cannot continue living my life like that. So every day I'm miserable, I'm hot, I'm itchy, my head is hurting, my stomach is hurting. It's not only just being irritable if somebody being around you, but you have constant headache, constant skin condition, and it's just unbearable. So you're thinking, I'm going to have to take that drug. Even if I'm going to take it for a month or two, I'm going to take it because I need a break.
So sometimes there are times even when the patient is even unconscious, where the doctor or the medical person has to take a decision knowing that there are side effects, but in the greater interest, the immediate, the moment calls for that now.
Yes. Emergency situations, if there is a need to talk with the family members, they have to do that as well. Let them know what the consequences are. So
because it may be, as we said, death too.
Yes.
And they have to inform the family first.
Yes. So if the benefit outweighs the risk, then you go for it if you think you want to. Some people might say, no, I'm not taking it. Let's just let this thing take its course. You understand? But others will say, let me try it out and see. Because I have a friend who is going through menopause and she just could not believe that her life had changed so much. And after finding out, after years of doing all different tests, nothing, can't find anything until it's okay, well, it's menopause, and so they had to put her on some hormonal therapy. After taking it for 1 month, she had just transformed totally to the person that everybody knew. But then she told herself, okay, I'm just going to take it for 1 month and then stop maybe the next month and take it again. Because you can do that. You have a choice to do that, to help you feel better, live a better life, wholesome kind of life. So again,
medicine do, as we said, make you feel better.
Yes.
Of course. But
it does make you feel better, but there's a possibility, yes. So we're again discussing that here to let you know how to manage your medication at home.
And that's why it's important to talk to your pharmacist.
That is why it's important to talk to your pharmacist and to your doctor and the other healthcare givers.
And we've spoken about that already. We just said that too, about talking to your pharmacist. But are there any other things that can be done to reduce side effects?
There are a lot of things that can be done to reduce side effects. A lot of them. first by starting talking to your pharmacist or to your doctor about the potential side effects. That is like number one. You need to talk to them. You need to know what are the possible and potential side effects with any medicine you take in, whether it's a prescription, whether it's a non-prescription drug, whether it's a herbal medication, any of those things, you need to speak with them. You need to know your medicine. You need to read labels and follow directions. You need to know your healthcare history and share it with your healthcare professionals. You need to avoid interactions with certain drugs that you're taking, and that will help minimize any side effect that is possible. So you need to speak to your doctor, speak to your pharmacist, and that can certainly help reduce the chances of some of the common side effects.
Okay, and what action should I take, should anybody take if they experience side effects?
One of the most critical things, if it's an emergency, something where you cannot breathe properly, chest pains, then you definitely need to call 911. Okay? If it's not an emergency, like you can tolerate it for some reason, you need to note the side effect and consult your doctor. If you have any concerns, the dose or the type of the medication may need to be adjusted. If you're sensitive to a particular medicine and a substitute is not available, your doctor might have to do what we call a desensitization therapy, where it means he has to try and gradually, continuously for a period of time, get you familiar with the drug, so he has to continue using it. Because if it's something that you need the drug and nothing else is available, he's going to have to do that.
Work with you,
yes. So keep track of your medicine effects on your body and mind. Ask your doctor what to expect from your medicine. How soon should you experience improvement? What side effects may occur and whether you will need any follow-up testings or monitoring. Know what to do if you experience side effects and when to alert your doctor. If in doubt about whether to alert your doctor, it is better to do so. It's better to do so than not do that at all. It is a good idea to write down any changes or possible side effects you experience. So when you go to your doctor, you will let them know so that next time.
And also, have your journal.
Yes.
And document it.
Yes. Also, let your pharmacist know whenever you go to the pharmacy. If you're allergic to penicillins, if you're allergic to sulfur, let your pharmacist know, because you might have missed it. You may go between pharmacies. One pharmacy might have it noted, another one don't, and they might dispense something to you. It doesn't come under the name that you're accustomed, that you think you're allergic to, but a class of that drug you will still be allergic to. You understand? So you may not be allergic to penicillin as a drug, penicillin, but you could be allergic to amoxicillin. It still falls within the drug of the family of penicillin. So make sure to tell your pharmacist. Yes. So make sure you tell your pharmacist what you have been allergic to in past. Sometimes it's not an allergy, it could just be an intolerance. But anyway, discuss it and then we can guide you as we go along. So speak to your pharmacist, be patient, do not rush your pharmacist. You see how critical it is that I always keep telling you, do not rush your pharmacist, simply because of what we're talking about today. Understanding side effects and how critical the side effect can be if you don't follow strictly as prescribed, and how to take your medicine. If you don't do that, we can end up in problems. Right, so do not rush your pharmacist ever. Do not rush your pharmacist ever. Speak to your pharmacist, speak to your doctor.
You can rush your baker.
Yes.
Because you are in bread.
That is right.
or
the fish.
Right.
Vendors.
But when it comes to medicine, that's a no-no.
That's a no-no. Do not rush your pharmacist.
Side effects. One of the
side effects. And this is why we're speaking about side effects, understanding it and the critical nature of not rushing your pharmacist.
On this note, we will end our program for today. Ladies and gentlemen, I hope you got something I did. Mm-hmm. And you can call us. The number to call is
440-8600.
That's it, 440-8600. And we spoke to you on understanding side effects. And we hope you will have no side effects because you'll be talking to your doctor, talking to your pharmacist, and you'll get everything okay. You'll read your labels, your prescriptions properly, take it on time and as you're supposed to take it. And so you'll reduce the risk of having any side effect.
But there's no fear in taking your medication, no fear in continuing to take your medication, no fear in taking your herbal medication. But speak to your pharmacist, speak to your doctor, understand the medication that you're taking. Let us reduce any of those. Like we said earlier, even your foods can have side effects. So everything as a whole can have a side effect.
Dumbo has a side effect. You too much Dumbo, you know what.
Exactly.
On that note, we will definitely end. See you next week on Tablets and Phones. I'm Felix Anderson.
And I'm Martha Augustus.
Good afternoon.
Good afternoon. Morning.